All right, direct vasodilators. This is our last class for this particular lecture. They do exactly that. So the mechanism of action. So direct vasodilators are really not widely used just because we have so many better options out there, but it's possible. So I'm just going to go through here and I'll let you know what you need to remember for this particular class, okay? So what happens? What's the mechanism of action? Well, we have, let me flip to this. Hopefully, hopefully that's just pretty clear. It causes dilation of those vessels, right? So we have direct arterial smooth muscle relaxation. So when those smooth muscles of the arteries are relaxed, we have a much better open hose. So we have better increased in transport of O2, nutrients, glucose, and then we have more regulated blood pressure. So we have decreased blood pressure. All right, so direct arterial smooth relaxation, therapeutic effects, we're trying to decrease that blood pressure, and then we'll have decreased constriction, decreased peripheral vascular resistance, decreased afterload. So hopefully all these arrows moving in the same direction makes sense to you now. You've seen it a lot. Indications would be for somebody who has hypertension, and then somebody who has malignant hypertension. So this would be hypertension of the patient that came in that's uncontrollable, right? So normal BP, we know it to be around 120/80, right? Or less than that. So if someone had very rapid, extreme increased blood pressure, that would be malignant hypertension, okay? So somebody with that would probably get a direct vasodilator to help bring down that blood pressure. We just have to be careful about not bringing down that blood pressure too fast. So precautions, concurrent use of multiple drugs affecting BP because we're going to have increased hypotensive effects. This drug is given IV typically. And then just be careful for renal disease and stroke, just again, because they have the potential for severe hypotension, low blood pressure. Contraindications, so the patient with cerebral edema, because it can actually increase their intracranial pressure, and then acute MI. Adverse effects or side effects would be headache and dizziness, possibly tachycardia where the heart rate will speed up. And then nursing implications, we're going to assess the heart rate and blood pressure. Patient education is pretty much the same, right? Drug side effects, BP monitoring, hypotension symptoms, other drugs which can interact or affect. A lot of this is repetitive, that's why I'm going through it fast. And then examples of drugs in class. So the only, oops, I didn't scroll. I'm reading, but not scrolling. I apologize. So the only drug in class that you'll have to remember for this particular, the only prototype you'll need to remember is the hydralazine, okay? So understand what a direct vasodilator does, right? It causes direct arterial smooth muscle relaxation. So what do we have? Dilation of those vessels. And then the drug you need to remember is hydralazine, okay?